Hello, I'm Gavin Love. I'm an orthopaedic surgeon in NHS Tayside and I'm the second year undergraduate lead for Musculoskeletal. Welcome to the video on hand, wrist and elbow examination. These examinations can be quite complex, but if you follow a simple look, feel and move system, you can add in a la carte tests for special tests as and when necessary.
Begin by greeting the patient and introducing yourself. Confirm the patient's identity and explain your role. Ensure appropriate infection control by washing your hands or using alcohol gel. Obtain informed consent by explaining the nature and purpose of the examination, and ensure the patient is comfortable with the process. With the patient sitting, inspect the hands and wrist. Make sure to compare each hand. Examine the dorsum for nail changes, muscle wasting, bony deformities, joint swelling or bruising. On the palmar side, look for pitting scars from ulcers as seen in systemic sclerosis, Dupuytren's nodules or contractures, muscle wasting and any obvious deformities. Start off by assessing temperature using the back of your hand. Then palpate the wrist joint, assessing for pain and swelling. Perform an MCP squeeze. Ask the patient to flip their hands over, checking the radial pulse, commenting on rate, rhythm, character and volume. Then check capillary refill time. Next, assess the movement of the hands and wrist. Again, make sure to compare each hand. Assess wrist extension using this maneuver and wrist flexion using this maneuver. Assess ulnar deviation, radial deviation. Ask the patient to flip their hands over to check for finger flexion and extension, followed by finger abduction and adduction. Finally, thumb apposition. When you move on to examine the elbows, start off by inspecting the elbows from the front and compare both sides for valgus or varus deformities, bruising, swelling or skin changes. From behind, assess for swelling of the olecranon, any bony deformity or soft tissue and skin changes such as rheumatoid nodules or psoriasis. Again, make sure to compare both elbows. Next, move on to palpate the elbow. Again, making sure to compare each elbow when doing so. Do this with the patient standing and the elbow flexed to 90 degrees as shown in the following clip. First, assess temperature using the back of your hand. Start off by palpating the medial epicondyle, the olecranon, and the lateral epicondyle for any tenderness or swelling. Then, with your left hand on the wrist and right hand at the elbow, palpate for the radial head using this maneuver. Next, assess movement. This is best done with the patient standing right in front of you so that you can easily compare both sides. With the patient standing in a T-pose, ask them to fully flex both their elbows. Then ask them to fully extend. Next, with the patient's elbows flexed to 90 degrees in front of you, assess pronation, followed by supination, again comparing both sides. Special tests can provide additional diagnostic insights, but should be selected based on the clinical context. For example, if the history suggests a scaphoid trauma, include the scaphoid compression test and anatomical snuff box palpation. Otherwise, this may not be necessary. Pincer grip, power grip, hook grip, fine pinch using a small key, coin or other small object, followed by tripod grip. Screen for a median nerve lesion by first assessing sensation on the index finger and resisted thumb apposition. To screen for an ulnar nerve lesion, first check sensation over the ulnar border of the little finger, followed by resisted abduction of the fingers. To test for a radial nerve lesion, check sensation over the first dorsal web space and resisted finger extension. Tinel's test for carpal tunnel syndrome. Phelan's test can be done by asking the patient to hold this position for at least 30 seconds to assess for carpal tunnel syndrome. Froment's test is done by asking the patient to grip a piece of paper between their thumb and index finger to test for an ulnar nerve lesion. This is a negative or normal Froment's test. This is a positive or abnormal Froment's test. To assess for scaphoid trauma, you can palpate the anatomical snuff box for tenderness, apply axial pressure to the thumb for tenderness, or palpate the scaphoid tubercle on the palmar surface for tenderness. Finkelstein's test can be done for de Quervain's tenosynovitis. If indicated, you can also undertake further palpation of the small joints of the hand, as demonstrated. Just remember, as you progress through medical school, your clinical reasoning skills will improve and you'll become better at picking the relevant tests based on the patient in front of you.